You're listening to Resilience Rising, the podcast that shatters poverty myths, sparks optimism, and fuels innovative change through community-inspired discussions.
So I'm Brian Shelley from United Way Simcoe Muskoka, and I'm joined by my co-host Amanda Fellows from CFS Counseling Wellbeing, and we are joined today by Trish Holloway and Joanne Flood, and we're going to discuss about how we can return dignity to the process of healthcare for those living in poverty and or living rough. And I wanted to start by kind of reflecting on the fact that, often when you hear these national polls of what people take the most pride in Canada or what defines us as Canadians, it's access to universal health care that comes up over and over again, that in hockey. But, what I think we have to understand is that access to universal health care is a privilege of middle class. And I think that's what we're going to talk a little bit about today, is about how that this concept of universal health care truly isn't universal.
Mm-hmm. Yeah, so we're really excited to have you both here talking about that. This is episode 7, where we're really going to talk about what it means to have a person-centered approach to well-being. So welcome to you both. Thanks for being here.
Thank you.
So I think it would be great if the listeners knew who you were. Maybe you could start out by introducing yourselves. Trish, did you want to take it away?
Absolutely. Thank you. Thanks so much for having us here today. My name is Trish Holloway, and I'm from the Lighthouse in Orillia. The Lighthouse is a service which has an emergency shelter, supportive housing, multiple programs that we offer to youth, adults, and families to support them in finding housing and emergency care in the meantime.
That's great. Thanks, Trish. And Joanne, did you want to introduce yourself?
Sure. I'm Joanne Flood, and myself and along with my partner Brenda Brown have started a company called Compassionate Care Without Barriers, CCWB for short, and it's a clinic in the downtown core. We're actually located in Trinity Anglican Church, and we're there to serve the people living rough and homeless, those living at poverty.
Thank you. So I'm going to start with a question for Trish. Trish, could you please speak to the work that the Lighthouse does to address the social determinants of health for folks living in poverty in Orillia?
Absolutely. So, the Lighthouse is in Orillia, and we work with our community. My role is Partnerships and Operations Director, so I have the privilege to work with a lot of our partners. And to answer your question, we are able to provide many services. And one primarily is to healthcare is our clinic. We have a clinic right on site, and our clinic is something that offers not only physical wellness care, but also mental health wellness. And we are able to create an experience where participants can come, whether they're registered in our program or whether they're a community person who might be not only at risk of homelessness, but also could be sleeping rough, or, as I said, in one of our programs. We create a meeting our participants where they're at type of scenario. So having our clinic there makes it so that the access to care is easier, and just something that can be a bridge into the community for.
So why is that important? Why can't someone who's living in poverty or living rough just access a walk-in clinic or the Emerge room, or we have access to universal? We can all have a family doctor. Pretend I don't know what I'm talking about. Why is it important that's located in the Lighthouse? And I know that it's a model that we've also seen. The Blue Door in Newmarket has that as well.
Yes. Well, I think it's because the individuals that we are serving, they are like our amazing shelter staff will be able to take care of their needs in offering them, a bed, access to healthy meals, access to all of the community programs and referrals. But the participants who are coming to us, they're building relationships with our staff. They have they may come from a background where they may not trust, the experts, EMS, different organizations within the city. So if we can meet them where they're at, and we can build that trust currency and create that, that mentality of, I went and it was just down the hallway. It was at a place where I feel safe. I went and now I feel like I can do it again. So if they're having those interactions and they're successful over and over, well, if they're successful in getting a unit in our community, well, then they're going to have that confidence, and we just want to be part of making a safe place, but also building that confidence, more or less like scaffolding, so that we're kicking some of the stigmas that they may have around some of these healthcare providers, and instead of being like, this is something I can't do, it's unknown, it's like what you did with us at the Lighthouse, and now, like I said, you can do it again.
I think, when you touch on that piece around stigma in healthcare, I think that's a massive component to that, right? And what I love about what the Lighthouse has done bringing a clinic in is the Lighthouse is a safe place for many people. And so because they already have that established relationship for people, then any services you bring in automatically get some of that kudos or street cred.
Street cred, I was just going to say that, yeah.
Street cred around also being a safe place, because we know that many people in an emergency room or at a walk-in clinic often face that stigmatization, which makes them reluctant to continue to search for that service, right? And I wonder, Joanne, if you could speak to, how that fueled the establishment of Compassionate Care Without Barriers, that mentality.
Sure. So I guess that this was a dream of ours. We were doing a lot of volunteer work with Busby. I was going out on the Busby van a number of years ago. My girlfriend Brenda's a nurse practitioner. She was doing some volunteer work. And what we were seeing we were going out to the bush to hand out sandwiches or whatever, but we would see people with obvious infections. They had coughs and colds and flu, or they'd have skin infections. I would get a phone call from Brenda on a Saturday afternoon to say, I'm heading out to the bush right now. If I don't return, this was the last place I was seen. And I'd be like, you can't do that. You can't just go off. And there was just such an obvious need that we had this dream of just opening a clinic and serving the people that we were seeing out on the streets. And I guess the population that we're serving, there are a lot that are attached to the shelters, and we get referrals from Busby Center, Salvation Army, John Howard, Elizabeth Fry, but there's also people that are not attached to a shelter, and they are living on the streets. And so what we've started to do is open on Monday mornings at the breakfast program hosted by the Trinity Anglican Church, and people are free to just walk over, and if they have an infection or whatever their need is, they can just pop in and get looked at. I have to say that there is some distrust. They're not quite sure why we're there or what the purpose is, but we're slowly building relationships and gaining that trust, and they're just being at where they're at.
And that's natural, right? I mean, if I think about myself, so when I go into the doctor's office and I get my blood pressure tested,
yep.
My blood pressure's jacked up, and that's coming myself as a middle-class person with a privilege walking in the doctor's office, right? So we know that we all feel a level of stress with healthcare practitioners, and I'm not living in day-to-day trauma and survival, right? So I can only imagine how that can be elevated, and or dealing just with survival day to day, and then you're adding another element, and you're adding someone that's coming from in an institutional setting or traditionally institutional setting.
Well, and I think there's a lot of stigma attached to the people that we're serving, and so they haven't necessarily been well received when they've gone searching for healthcare. They were already preconceived that part of their problem is whatever their issue is. So whether it's addiction or mental health or whatever that looks like. So a lot of the feedback we get from the people we have been seeing is, wow, they actually listened, or they took the time to talk to us, or they took the time to get to know us. And it's like taking care. We've seen people with diabetes that hadn't been detected before, or high blood pressure. There's mental health issues where they're just looking for counseling or some antidepressants or whatever it might be, but they're walking away with what they actually came looking for, as opposed to no judgment, no barrier, no No, nothing. It's the person that matters.
If I can piggyback something, Joanne, that you were sharing, is that piece about how the trust is there. We sometimes will have partners, and they're coming from a really good place. I do believe that. They'll reach out to us and ask if they could come along with our outreach team into the areas that are sleeping rough. And, in my role and our team, we have a boundary for that, because, this is their life. This is a choice that they sometimes, that some of our participants are choosing this lifestyle, or they're in between, the next healthier, safer option. So we just have those boundaries to say, we are like, when someone now sees a Lighthouse, they're coming to us to say, how are you guys doing this, and how are you creating these numbers to have this much support? And we're like, well, we couldn't do it without the community partners, but also sort of modeling to them that it's like, well, we want them to come and we don't want to wreck that feeling where they feel safe. No one should be on parade.
No, no.
I want to build on that, because I think you've touched on two pieces there. You've talked about trying to maintain the relationship and maintain dignity, but also you've spoken to the fact that partners are key to the work that you do. So maybe you could kind of flip that around. What have partners brought to the table, and what have partners done to help you move this initiative forward?
Yeah, well, we started our capital campaign, and we built from the ground up a large facility in Orillia, and we've been able to serve many different people, but it was a grassroots organization at first, and we welcomed the Simcoe County paramedics, CMHA, and also the Simcoe Muskoka District Health Unit as well. Let's not forget their acronym and their greatness. And we were able to bring in nurse practitioners, doctors. We had the Kuchaching Family Health team align with us, and we had these committees at the beginning, and the committees were, service delivery, and then it branched off to a medical clinic working group, and even Joanne met our visionary, one of our nurse practitioners, Nancy Sutherland, and, with their visions aligning with our visions, we like to choose partners that are like partners, so that we all see the individuals who are experiencing homelessness as people, and we see them that could be us at any moment as well. Sure. And just making sure that everything is and then building on that.
And that's that person-centered approach that I think is so critical. When you talk about meeting people where they're at, it's viewing the person as a whole person, right? Not judging them based on a symptom of their circumstance, right? Which is often trauma and all of those other, layered elements. So I think that's key. And I think collaboration and partnership, and even just that piece that you shared around, partnering with like-minded organizations is also critical, right? In order to create that circle of care around people, recognizing that not one organization should be the only organization that supports a human, right? And we have to be able to build those bridges and create safety with other community service providers too.
Well, and I never imagined, our executive director, Linda Goodall, she gave me this forewarning that this would happen, that, as we, met our vision, and we still have lots of strategic goals and things like that, but that people would be coming to us and saying, well, how are you doing this? And it's okay, sure. But that's happening, the partnerships with the Kuchaching Family Health team, they came to us, and the Lighthouse was one of the first charities to align with that greater, healthcare stream. And, I'm sitting here going, that's what they said was going to happen. And I'm pinching myself okay. And even being here today, it's well, yeah, this is that client-centered, participant-centered continuum of care, wraparound services, and that we're all just wanting the best, the safest, because we never know. We never know that might be one of us, and we never know if it's your neighbor, any family member, anyone that's loved, anyone that comes to the Lighthouse, anyone who comes to your program, is someone's daughter, is someone's son, and yeah, we just want, and what you're saying in Canada, we want, everyone to have equality and safety, and we just want them to feel like when you go somewhere, you're going to get the same and equal.
You're going to be heard and taken, yeah.
I think sometimes we underestimate that piece around, the facet of listening and actually hearing somebody and what that does really to return dignity to the experience, right, for somebody, and how that makes a difference.
Yeah. I'm fighting for our clients that are coming in, or the people coming in. It's very, very difficult to put that step forward to even seek assistance. So
maybe could you elaborate on that a little bit? Just maybe speak to the experience of your clients and how your work in healthcare is helping to address health equity.
Sure. I find particularly through the breakfast program now, we changed to that in January. We're right next door, so they go and have breakfast, and then if the people serving the breakfast see something, they might suggest that they come over. But they come in kind of very hesitant. They don't know what to expect. And it's, like I said, it comes back to building the relationships and the trust. And I find that when they leave feeling very heard, very validated, and feeling like somebody actually cares and is there to help them. So whether that's medications or tests, a lot of times, Brenda will send them for an X-ray or blood work, that type of thing. So,
one of the key testaments I think to that is, and I've heard you say this historically, and I wonder if this is also the experience of folks at the Lighthouse, is that people keep coming back,
yes.
right? And so for me, that is a clear outcome of, that you've created a safety, right? You've created a safe space. And so even if I think about that in the context of the social determinants of health and access to healthcare being a key element of the social determinants to health, it's one thing for people to pop in and get service one time, which is helpful. But on the flip side, if there's some of those preventative pieces that people need to access, if there are chronic issues that people need to continue to follow up on, we need to ensure that the services are, creating that space where people feel like they can keep coming back, right? So I've heard you talk about that before. I wonder, Trish, if you have had a similar experience.
Absolutely. One thing that I have sort of just ingrained in my industry and serving and helping others, a part about where the Lighthouse, mission and values come from is that, statistically, and I don't know the stat for the number per se, but statistically, individuals who are experiencing homelessness need to go through around 14 doors, units, rooms, apartments, bachelors, before they find a unit that is safe for them. So we had a great mindset shift a couple of years ago, maybe 5 years ago, where it was like, okay, it's not like, 30 days in, 30 days out from a shelter. Well, what good is that? What kind of rest are they having, right? Instead, it was like, okay, we're going to be housing focused, and we are going to do everything we can. We're going to, align with these partners, and we are going to give you everything you can. And as soon as you come into shelter, we're actually going to encourage rest, because experiencing homelessness is not an easy task, right? So rest, use these partners, see the paramedics, talk to the doctors, visit the foot care. Last Thursday, we had someone coming in doing haircuts, like restoring that self-worth
Dignity.
and dignity, yes. And just making it so that, no, you didn't fail on your third unit. In fact, 3, you have more to go. And welcome back. Let's keep working on you, and let's keep, connecting you, referring you, encouraging you, seeing you.
That's a theme that keeps
awesome.
coming up in a lot of these episodes that we've been doing through the Resilience Rising podcast, that we have to understand that it's a continuum, right? And none of these solutions, whether it's from a government perspective or from a social service perspective or a grassroots perspective, none of them are one and done.
No.
We're helping people along continuum, and maybe the end game is being housed. Hopefully, maybe it is. But regardless, we need to understand that this is people on a journey, and that it's a journey process. And the Band-Aid solutions are just that.
Absolutely.
That's right.
If you had a group of folks standing in front of you and you could, tell them something about the clients you support, about poverty, about taking a person-centered approach, about health equity, like about what they can do, what would you tell them?
This is your mic drop moment.
Yeah.
Joanne?
What they can do?
Yeah, what can they do?
What do you mean, what can they do? What do you mean?
What can they do to support the community? Like, what could they do to, so
Like
whether
to
that's...
our audience?
Yeah,
Why- to our
like,
listeners?
What's
Oh, I
important
see.
for people to
Okay.
know? Yeah, sorry, to the listeners. If you had your whole audience
Let's
was listening.
let's say you're speaking on a podcast and you have people listening to that podcast. What's the one thing you'd want them to walk away with?
Yeah.
Oh my gosh. You know what? There's so many things I would love to change, especially with this population. It upsets me that there seems to be so much fear and there's so much preconceived notions. There's so much, I spent a few hours with my husband in Emerge last week. He had an accident. We ended up in Emerge at 9 o'clock at night. We were there till 3:30 in the morning. And we saw people coming in. There was one instance where one of the workers in the hospital went over to talk to someone else and said, so-and-so sleeping on the Emerge floor. We're about to call security. So if you hear yelling, that's what's happening. And then sure enough, 10 minutes later, we could hear yelling and I'm like, why can't that person just sleep on the floor? They weren't hurting anybody. I was at a hospital down in Toronto, a major hospital. There was a woman in a wheelchair. She was sound asleep in the Tim Hortons, and security came and woke her up. And then they said, she was getting upset, and they said to her, well, now you're getting aggressive. You need to leave. And they physically wheeled her out in her wheelchair and left her at the bottom of the ramp in the middle of winter. And it's like, these people are people, and like you said, Trish, there's somebody's child, there's somebody's parent, there's somebody's relative, and we've lost the human aspect of caring for people. And at our clinic, we're treating the person as a person, and I would love for people to see them as people. Regardless of what the issues are, they're people first, and they deserve the respect and the dignity.
Great mic drop moment.
It drives me crazy. It's not something that you can just get rid of or push under the carpet. It's something that needs to be dealt with. And it needs to be dealt with well.
Well, that's a lot to follow.
I am so
So
passionate about this. It's just people are people.
Amazing.
And get past everything else. Treat the person first.
I think I would mirror a lot of what you're saying. I know that for sure. The Lighthouse believes that everyone deserves hope, home, and a future. And Brian, you shared a word that should jump out at everyone, and it was the word Band-Aid. And I am working in emergency shelter. My team, our incredible team, including our donors and our partners in Barrie and our partners in Orillia, everyone is working together to do this. But let's make sure we keep our eye on the actual solution. So if we're talking about housing, and I have a mic drop opportunity, I am going to say that affordable housing is the solution. However, emergency shelter is the Band-Aid.
Mm-hmm.
So,
and unfortunately, the necessary Band-Aid right now.
right, absolutely.
Yep.
But if everyone can focus in and bring that spotlight to, dignity, access to healthcare, hope, home, a future, and each person is somebody, then I think that we will stop moving the spotlight all around and really just hone in on the big solutions, and let's stop settling for Band-Aids.
Mm-hmm. I don't know how many people that come through the clinic say, I just really want to get a job, or I really need housing. And could you imagine if everybody had a place to call home and had their healthcare needs met, what they could go on to accomplish? Those are the basic essentials for everybody. Every human being is entitled to a home and healthcare.
Kind of brings us back to where we started, right?
Mm-hmm. Yeah.
Where we started by saying, what do we define ourselves as Canada? And clearly, we are letting down a portion of the community, of our country, of our population, and we have an opportunity to do better.
Mm-hmm.
And it's not easy work,
No.
and it's not for the faint of heart. But if we have people behind us encouraging us, supporting us, making donations, looking for how can I help instead of just turning like it's hard to look at. Some of the stuff that we do and that we show up for every day is tough to look at, but look past the stigma and, volunteer, jump in there, really get to know your neighbors, because some of your neighbors are experiencing struggles and trauma, and they didn't ask for some of this. So, just dig a little deeper, look a little harder.
Everybody has a story, and all of us could be in that situation one day.
Joanne and Trish, I want to thank you, first of all, for the work that you do to strengthen our community, but also for coming today and being our guests on the podcast. I would also like to thank our guests at Uplift Black. We recorded today's podcast at their Upbeat Box studio in downtown Barrie. And finally, I'd like to thank you listening to the podcast. If you enjoyed it, please share it and follow and subscribe. You can follow us on social media using the hashtag ResilienceRising.
And we'll see you next time on episode 8, which will be dropping next week when we discuss community collaboration. And I'm Amanda Fellows of CFS Counseling and Wellbeing with my co-host,
Brian Shelley from United Way Simcoe Muskoka.
And we're asking you to embrace innovative change to ensure our communities are great places to live for everyone.
Thanks so much.